Pharmaceuticals that end up in our waterways can have serious consequences for both our ecosystem and the human health. Unfortunately, a large amount of these residues are released into our environment without a proper treatment.
A traditional wastewater treatment plant treats BOD and COD, which is organic matter. That's the primary function. However, there are micropollutants, and one of those are pharmaceutical residues. These are not treated. Even if they are treated, it's maximum 20%. With our technology, we can remove these pharmaceutical residues completely from the wastewater using the proper technologies. In order to remove the pharmaceutical residues which are left in the wastewater treatment, we need to add a fourth treatment step. This is called quaternary treatment. This quaternary treatment consists of three main process steps. The first one is to remove particles, because there will still be particles going out from the wastewater treatment plant, and especially for sewage treatment plants which do not have biological treatment, which is quite common. The second step is ozonation. The ozonation's main function is to oxidize and neutralize the pharmaceutical residues after the particle removal. This is the core of the process, where we remove at least 80 to 90% of the pharmaceutical residues. Any remaining can be polished in the third step, which allows for near complete removal of these micropollutants.
Treated wastewater is normally discharged directly into the river.
Now the water passes through a forced treatment stage where pharmaceutical residues are removed, hence only pharmaceutical-free wastewater is released.
With the help of an advanced pharmaceutical removal process, the water is purified far beyond what traditional wastewater treatment plants can achieve.
Traditionally, such a project is separated into a generic building and a standalone process design. As a complete EPC contractor, we're able to significantly reduce the building size and tailor it for the treatment process. What makes our facility unique is its modular design. Instead of investing more than necessary upfront, we can gradually expand capacity as needs grow without a significant additional footprint. This approach is not only cost-effective, but also a more sustainable way to build.
This building is engineered to handle discharge from a treatment plant without secondary biological treatment. This imposes extremely high demands on particle separation and contamination management. Therefore, not only does the facility act as a quaternary treatment stage, it also partially replaces traditional secondary and tertiary treatment stages. This is the first building in the world to be designed specifically for pharmaceutical residues, and it's designed to be an add-on to an existing sewage treatment facility. We need to design our facilities to remove at least 80% of the pharmaceutical residues, according to the Urban Wastewater Treatment Directive. In fact, we aim much higher than that, targeting at least 90 to 95% removal, exceeding by far the wastewater treatment requirements.